So today we're watching a video about reconstruction of the buttock after silicone removal by transferring fat from the tummy, hips, and backside. This is a 36-year-old female, weighs about 160 pounds, and previously she'd had silicone injected into her buttock. So the first thing we did is we removed the silicone from her buttock with the closed technique. So you can see here, this is her before buttock, before we removed the silicone with the closed technique. And then here is the buttock afterwards, after I removed the silicone and the scar tissue, and it's pretty flat. She wants her buttock reconstructed. So what we're going to do here is I'm going to take fat from the middle back, the lower back, the front of the tummy, the middle tummy, the lower tummy, get all that fat like a 360 lipo, purify that fat, and then inject it into the buttock for reconstruction. So this is buttock reconstruction using a BBL or fat transfer, where we get it from the tummy, hips, and backside and transfer it to the buttock. This is the best way, I think, to do buttock reconstruction after silicone removal. So we're going to get fat from here, the upper tummy, middle tummy, lower tummy, love handles. Some people call it a 360 lipo because we're going 360 around the patient's torso. And that's really good fat to harvest. Even if the patient's had a previous tummy tuck here, we can still get fat. So we're going to get a lot of fat from the back here. She has some rolls of fat here. So there's a lot of deposition of fat here in the middle of the back and the lower back. And that's really good fat for the transfer to the buttock. So I think because of the tummy tuck, she's going to snap back even better because a lot of that skin is gone and it won't lead to laxity of the skin. So we're going to take all that fat here and we're going to transfer it. You saw that profile of her buttock is a really flat buttock. So we're going to inject it into quadrants here: upper inner, upper outer, lower outer, and lower inner. So the first step is liposuction. So here I'm doing liposuction of the tummy. You have to be pretty aggressive because of the scar tissue here. We're doing liposuction of the abdomen. We're doing liposuction of the love handles here. So we're doing it on the sides here. We're doing it on the tummy. We're doing aggressive liposuction in the love handle region here. This is sped up a little bit. I'm not quite that fast. And then this is the accumulation of the fat. Okay, first of all, we put tumescent solution in there to minimize the bleeding, minimize the pain. And then after that sets in place for about 20 minutes, 30 minutes, then we harvest the fat. So here we're harvesting even more fat on the abdomen. We're trying to get that tummy nice and concave and nice and flat and harvest as much fat as we can. And then we take the fat and we strain it. So we get rid of the impurities namely being tumescent fluid, okay, the stuff that we injected to minimize the bleeding and minimize the pain. And also there's a little bit of blood in the specimen that all drips through. All right, so we strain it to get rid of those impurities, so we're wound up with pure fat. We're going back and getting more fat, especially over this love handle region, giving her more of an hourglass shape. So we're pretty aggressive here over the love handles. We use several different size cannulas or straws. Those are those medical tubes, if you will, to aspirate or remove the fat, specifically here in the love handle region. And it's pretty exhausting work. It's pretty thick with scar tissue, especially since this patient had a tummy tuck. But you need to dislodge that fat and aspirate it into this tube. So these metal cannulas are like straws and they're connected to suction. So what I'm disrupting in here then gets sucked up through the tube and then aspirated into this canister here. And now we've flipped the patient over. She's face down, and I'm at the top of the buttock crack here doing the back of the love handle region and doing the base of the back. So you need to be really careful when you're doing liposuction back here because you don't want to connect where you have liposuction from to the buttock. Otherwise, when you inject the buttock, then it's going to spill into the areas where you've just aspirated the fat. So now we've taken our fat, we've put it back in the canister, and now we're injecting it through the tubing back into the buttock. So now the patient again is face down, her head is up here. So I'm injecting fat into the buttock now and rebuilding this buttock. And I'm at the top of the buttock crease here, buttock crack, and we're injecting it into the areas here. So here you need to be really careful of blood vessels. There are significant blood vessels in the buttock. You definitely don't want to get into them. You don't want to inject the fat into the blood vessels because that could lead to a fat embolism and that could be fatal. You definitely don't want to get into the muscle. We don't inject fat into the muscle. We inject fat into the fatty layer. So here you can see I divided into quadrants and I inject fat equally into each quadrant to build this buttock up. I use several different approaches. We've gone through previous scars here to augment the buttock here. So you can see I've done aggressive liposuction in the low back here, indenting that area, getting a nice concave shape. I did a lot of aggressive liposuction love handles there to give them more of an hourglass shape. And then we inject it, we sweep it into the buttock here. So she has a nice projection of the buttock here. Again, remember we did fat transfer of the buttock. Remember how flat she was. We put about 2 liters of fat into the buttock. So that's a lot of fat on this patient. We're going to lose about 20% of the fat just because that's the way patients heal and they aspirate. And then that swelling will go down a little bit. So I think this is going to be an excellent result for the patient. And we're going to see this projection from her lumbar, her lower back here into the buttock. See how that slopes out? Really good shape here. So you can see here post-operatively, look at that hourglass shape that we got her, really chiseled that in. Look at the augmentation or the increase in size of her buttock. Look at that much better buttock shape here. See how it kind of comes in and kind of comes out. So we get a better buttock shape with the fat transfer. We get an overall better body shape with the liposuction. So it's a win-win situation. So the success of the body lift really depends on, you've got to have fat to transfer. We've got to do the surgery just right. And then the buttock has to be willing and accepting of that fat. Well, one, you've got to want the surgery. You've got to maybe have a flat buttock that you don't like. Number two, you've got to have the fat to transfer. If we're doing a fat transfer, the success of the fat transfer really depends on if you have fat. If you come in the door and you only weigh 100 pounds, you don't have enough fat to transfer. So the BBL is definitely not going to work, no matter how skilled your plastic surgeon is. So you've got to have fat to transfer. So you got to have fat to transfer. And then two, the buttock has to be willing and acceptable in terms of anatomy to accept that fat. So yeah, so one, you've got to be wanting the surgery. Two, you've got to have fat to transfer. Number three, your buttock has to be soft and willing to accept that fat. And four, you really, if you've had silicone injected, you really need to be free of that silicone and free of any silicone symptoms. If you have silicone still in there and if you have symptoms and you need more out, get that out definitely before you do any reconstruction of the buttock. It doesn't really make any sense reconstructing something unless something is fixed underneath first. So I think it's really important to go to a specialist. A lot of plastic surgeons, a lot of doctors don't even know about silicone injections. They've never seen it before. They've never treated before. So we've done hundreds and hundreds of patients, silicone removal with the open technique, or with the closed technique, and then the reconstructions afterwards. So I really think it's important to go to a specialist who deals with silicone removal and the reconstruction thereafter on a daily basis. Yeah, so after the closed technique or after the open technique, your body heals by making scar tissue. And then it takes a while for that scar tissue to relax. So once the tissues are relaxed, then we can do reconstruction. But if you do the surgery too soon, once the scar tissue is not really relaxed, you're not going to get a successful surgery. A lot of the times too, we have to release the scar with surgical techniques, surgical trade secrets, that we release the scar and allow us to put the fat back in. So you really need a specialist. You really need to wait the appropriate time. You really need to release that scar so the fat really takes in those areas. I think this is the best way to maximize fat survivability. These techniques that we use, the way we inject it, the positioning of the patient post-operatively, not sitting on the buttock for a good 3 weeks, not sitting on the buttock for the first 2 weeks, and then the third week is with a BBL pillow, not really laying on your buttock, and really giving those little baby fat cells that we transferred to the buttock a chance to survive. Garment is also very important. Garment decreases the swelling in the areas that I did liposuction. Garment's also very important to allow that buttock not to get too much pressure on it by swelling up. So I think a garment's important for the buttock, garment's important for the liposuction areas, and the recovery position after the surgery is you're going to be flat on your tummy, buttock in the air for a minimum of about 2 or 3 weeks. A lymphatic massage I think is very important. Lymphatic massage basically is a massage technique which is very gentle. It massages the lymphatic fluid or the swelling fluid that you develop after any surgery, especially liposuction, and milks it back into the inguinal nodes or the lymph nodes. And I think that's very important. I don't do it right away because I think it can stir up bleeding. I usually wait about a week or 2 weeks once everything is settled down before we initiate lymphatic massage. The techniques of fat transfer. We suck the fat out. It goes in a canister here. We strain it to get rid of the impurities like the tumescent fluid, like the blood, maybe some scar tissue, residual, things like that. We wash it with antibiotics, get it nice and clean, and we only take the good fat. So a lot of plastic surgeons suck this stuff out and then inject all that stuff back in. I don't think that's a great idea, and that's why maybe they only get 50% of the stuff to survive, because a lot of what they're injecting is tumescent fluid, maybe it's blood, and a lot of the impurities. So we strain the stuff to get the really pure stuff. And then once I inject it, we're very careful on how we inject it. We use a specialized cannula. So when we're injecting, we tunnel it, and then we inject it when we're coming out. So it already has a tunnel, and when you inject the fat, it fills in that tunnel. Also, I imagine sort of this three-dimensional tic-tac-toe board, deep, medial, a little bit underneath the skin, and then just underneath the skin, all those little levels. And I try to crisscross all the fat in there. I start out deep at first and then go more superficial, but I never go in the muscle. I don't think that's a good idea at all. So usually after a BBL without silicone reconstruction, usually that's going to be about 6 to 8 weeks. Now, if you've had silicone in there before and you've had a previous surgery, it's going to take longer to heal. The buttock's going to be like, what, again? So it has to heal. So it takes a little bit longer after silicone removal. And that usually takes, I would say, maybe in the order of about 12 to 14 weeks. So here you can see, look at how much better buttock shape she has on the hips. We transferred fat to the buttocks, to the hips here. And you can also see a much better hourglass shape. You can see these fat rolls before. Now they're gone. So these surgeries I perform under general anesthesia with a board-certified MD doctor anesthesiologist. Sure, you can do it under local, but it's extremely painful, and there is a maximum amount of fat you can take out with the local technique. With general anesthesia, you can take out a lot of fat very safely because we're not depending on the lidocaine in the tumescent solution. So you can take out more fat, it's less painful. And these procedures, when I'm doing liposuction and fat transfer, typically take about 3 to 4 hours, depending on the amount of fat that needs to be taken out and depending on what size of buttock do you want. So if you want to see more before and after pictures, go to our website, www.timothykatzen.md, and go under the before and after sections, and you can look under silicone removal and silicone reconstruction to see a wide variety of patients, whether we've used the closed technique, like in this patient, where we've transferred the fat, or maybe we use the open technique with the incision and then transfer the fat, or maybe we've put in buttock implants or sculpture, or maybe they've used squats to exercise and increase the size of the buttock. So thanks for watching. Please subscribe. We'll see you next time.